Hello everyone and welcome. Today I'm going to give you a little sports medicine tip on the application of ice and the injury cycle from an acute injury. So when you sprain your ankle or get something falling on you or hit and you got a contusion or bruise, the first thing we want to do is address it with ice. For the first 48 hours, you have trauma to the tissues. You have inner cell fluids that are dead and are squished out, and that increases the swelling. So with an injury, you get redness, you get heat, you get swelling, and you definitely get pain. And sometimes you can even have some dysfunction with that as well. So many of you have heard about that acronym ICE. Stands for Ice, Compression, Elevation. So we want to use that to the best of our ability to help eliminate some of that swelling and pain and everything that's involved there. So ice is appropriate for the first 48 hours, sometimes even a little bit longer, but we want to use that to control those elements. And a good application for that is for 15 to 20 minutes. When you do it that long, then your body needs time to get back to normal, and so give it an hour's rest in between, and you can certainly go with ice again after that. You don't want to go with like a full hour of ice directly, because then your body will send signals to address that and say, okay, I don't want to deal with frostbite, so we need to pump more blood back into it. And we don't want that reverse effect. So once again, we're talking about 15 to 20 minutes of ice application. If you can, do some compression wrap to it as well. And maybe you might need some pain reliever to go along with that. So that's not a problem. But don't forget, if it's that bad and certainly that much trauma, certainly go to the emergency room or urgent care to get it taken care of. Certainly you don't want to have something that gets worse or maybe needs more attention to it than originally founded. So just another tidbit for the day. Hopefully we can get you weekend warriors back into commission, and this helps understanding a little bit more for how to care for your injuries. So take care and look forward to catching up with you later.